Hi guys, my name is Dr. Lee Sung. Welcome to my YouTube channel. What if the little pill people call a performance booster is not just about better sex, but about hidden risks most people never think about? Let's talk about something a lot of people are curious about, but very few fully understand. Medications like Viagra or Cialis are often seen as shortcuts, a way to improve performance, confidence, stamina, and because of that, many people wonder, can I just take them for fun? No medical need. No diagnosed issue, just curiosity or the desire to feel more. But here's where things get important and a little misunderstood. These drugs belong to a class called PDE5 inhibitors. They work by affecting a very specific enzyme in the body, called PDE5, which normally breaks down a chemical called cGMP. Now, cGMP is what allows blood vessels to relax. And when blood vessels relax, blood flow increases, especially to the penis, which is what makes an erection possible. So when PDE5 is blocked, cGMP sticks around longer, blood flow improves, and erections become easier to achieve and maintain. Simple enough, right? But here's the part most people don't think about. These medications were designed for people who actually have erectile dysfunction, a medical condition not as a performance upgrade for someone whose system is already working fine. And when you introduce a drug into a system that doesn't need it, the effects don't always stay predictable. Some people take them and feel fine, maybe a bit flushed, maybe a headache, maybe a little lightheaded. But others, especially when mixing them with alcohol or recreational substances, can experience stronger effects than expected, longer duration, more side effects, and in some cases, risky interactions. And then there's something more serious, something called priapism. That's when an erection doesn't go away, not after minutes, not after hours, but beyond 4 hours. And this is not extra performance. This is a medical emergency. Because when blood gets trapped in the tissue for too long, oxygen levels drop and tissue damage can begin. What starts as something people joke about can actually end in permanent harm if not treated quickly. There's also another layer people overlook. These medications don't just act on the penis, they affect blood vessels throughout the entire body. That means blood pressure can drop. And in certain situations, especially when combined with nitrates or other substances, that drop can become dangerous. Some people also report visual changes, slight color shifts, light sensitivity, or a temporary blue tint, usually short-lived, but still a reminder that this isn't a targeted effect, it's systemic. And then there's the psychological side, which is just as important, because once someone starts relying on a pill for confidence, even if they don't medically need it, the mind can start to associate performance with medication. And that's where a subtle dependency can begin. Not physical, but mental. Now here's the truth most people don't expect. For many healthy men, these medications don't dramatically transform performance. The difference is often smaller than what social media or rumors suggest. Sometimes it's noticeable, sometimes it's barely there, and sometimes the expectation is higher than the actual effect. So the real question becomes, are you enhancing something that already works? Or are you introducing unnecessary risk into a system that didn't need intervention in the first place? Because sexual health is not just about intensity or performance. It's about balance, blood flow, hormones, sleep, stress, and overall health. And when those things are in place, the body usually performs the way it's designed to. So yes, these medications can be extremely effective when medically needed and life-changing for people with erectile dysfunction. But using them casually, without guidance, without understanding dose, interaction, or personal risk factors, is where problems can start to appear. So before experimenting, it's worth pausing for a moment and asking a simple question, is this about treating a real issue or chasing an unnecessary enhancement? Because in health, especially sexual health, the smartest improvement is not always more stimulation. Sometimes it's simply knowing when not to intervene. If you found this useful, stay informed, learn before you experiment, and always talk to a qualified professional before using medications that affect your heart, blood vessels, and sexual function. And if you want more clear, science-based explanations like this, make sure to follow and stay connected, because your health deserves decisions based on knowledge, not guesswork.